This is Selma Schimmel for the Group Room in Chicago at the annual AACR meeting. AACR is the American Association for Cancer Research, and we continue our discussion now with Dr., also Professor Josep Llovet. Hello.
Hello. How are you doing?
You are the President of the International Liver Cancer Association.
That's right.
Professor of Medicine and Director of the Mount Sinai Liver Cancer Program, Mount Sinai School of Medicine in New York City, Professor of Research in the Liver Unit at the Hospital Clinic in Barcelona, Spain. I think it's such an important point for viewers to get a sense of the global nature, international research that happens worldwide.
Yes, so first of all, HCC is the third leading cause of death and the sixth most common cancer.
The acronym of ACC is?
Hepatocellular carcinoma, liver cancer. So the most common liver cancer is hepatocellular carcinoma, accounts for 90% of the cases. Is the sixth most common cancer in the world, and the third cause of cancer-related death, accounts mostly in Asia, but we have 25,000 cases in the US every year, 60,000 in Europe. And the importance of the international research, to put the research in a context, is that the high-end technology, for instance, is led by one center. Imagine Mount Sinai, for instance, in terms of genomics, or Dana-Farber, Broad Institute in Harvard, whereas the best animal models to explore this disease are in other centers. So that's why we put together high-end centers of excellence in the research.
It's a consortium.
It's a consortium, the HCC Genomic Consortium, that received an international AACR award.
Professor Llovet, while you're here, you're presenting at this conference, liver cancer, pathogenesis and treatment. First, can you define the word pathogenesis?
Pathogenesis refers to the molecular mechanisms that underlie the development, initiation, progression, and dissemination of the disease.
So talk to us then about the nature of your topic for the patient audience.
So regarding pathogenesis, during the last 10 years we have discovered several mutations and several pathways that are involved in the pathogenesis of the disease. However, we are not at the level of what has been discovered, for instance, in breast cancer, in the sense that a subgroup of patients, the tumor is driven by a molecular alteration, and with a specific drug, you can block this molecular alteration. And as a result, these patients have a very good response. This happens with breast cancer, with GIST, with a subgroup of colon cancer, with other types of cancer in which a very specific molecular mutation is the driver of the disease. Ovarian cancer, you can block that, and then you have an outstanding response. In HCC, this is called oncogenic addiction loops. So the tumor is addicted to this mutation. In HCC, we have not discovered so far oncogenic addiction loops. That's why all the effort at this point is focused on sequencing the genome of the tumors to identify these mutations.
And so the goal is, as we have been able to identify lung cancer is another good example, mutations in these disease types, ultimately the goal is that you will also be able to identify genomic or mutations within liver cancers that will allow you to tailor therapy.
Exactly. So in HCC, let's say in terms of research, we are 10 years behind the other big cancers.
Why is that, do you think?
For several reasons. So the most important reason is that HCC was not a major public health problem in the West until 10, 15 years ago. 10, 15 years ago, NIH and the European agencies recognized this as a major problem. But it was not so because the incidence of the disease was very low, particularly in the US. In Southern Europe was somehow notable, but in Northern Europe and in the US, it was 3 to 5 cases per 100,000 inhabitants. So the incidence was low. So there was not very much investment from the government, from NIH, in terms of research in that area, and from pharmaceutical companies. There was no much alert about that. More recently, the HCC and liver cancer is the #1 fastest growing tumor in the US in terms of incidence. For the last 15 years, it has doubled the incidence in the US. And then there is a much important alert from NIH that has a specific calls, and the companies now have a huge interest.
Do you understand why there is this rise, this increase in these liver cancers?
In the incidence in the US. So the main reason is as a result of the epidemic of hepatitis C infection that happened in the US 30 years ago. And now this is impacting the incidence of cancer. So from the point you acquire the virus until you develop liver cirrhosis, the time frame is around 20 years. And from the time you have cirrhosis to you develop HCC is 5 to 10 years.
Where's the research with the glass beads that are used in the area of radiation?
This is a very important area of research that is growing. The beads are used to deliver internal radiation with yttrium-90. So we are using that to localize the radiation around the tumor without producing any damage to the healthy or the non-tumoral tissue, because external beam radiation for patients with cirrhosis is very toxic. And now with the development of these glasses, these beads of yttrium-90, objective responses and good responses have been achieved. And now these type of treatments are moving to phase 3 at this point.
So it's investigative. Patients can obtain the treatments at select centers, and we're waiting for the data, so it becomes perhaps part of the...
Particularly in the US, that they have access to this type of treatments at this point.
Are there any other investigative therapies that are compelling?
There are several molecular target therapies, so I think that this era, the important thing is the explosion of molecular target therapies. We have, at this point, 56 compounds in phase 2 or phase 3 that are aimed to improve the results of sorafenib that were already reported to improve the survival of the patient. I think that the most important advancements will come from these studies with these 56 therapies.
Thank you, Professor and physician Josep Llovet, President of the International Liver Cancer Association, Professor of Medicine, Director of the Mount Sinai Liver Cancer Program, Mount Sinai School of Medicine in New York, and Professor of Research in the Liver Unit at the Hospital Clinic in Barcelona, Spain.
My pleasure.
Thank you for helping us understand a bit more about liver cancer and what the future holds.
Thank you very much.